Welcome back, everybody. I'm the Doc Bob Lee from 107.5 WBLS, and you're watching Open. Thank you for joining us. Thank you for tuning in and checking it all out. Our last guest is a medical director for the Division of Disease Control and the Deputy Commissioner for the Westchester County Department of Health. He sits down with us today to share his thoughts on all the latest developments with COVID-19 and to provide some tips on maintaining healthy habits during the pandemic. So please welcome to the show, Dr. Dial Hewlett. Doctor, welcome.
Thank you very much, Dr. Lee. I'm happy to be here.
Thank you. What started your journey in the world of health and medicine?
Well, I actually got into medicine by accident. I was finishing my athletic career at the University of Wisconsin, and a counselor was asking me, what are you going to do next? And he made me aware of the opportunity to go to medical school. So that was actually how it all got started.
And then you went from there, you got involved, and did you also go to medical school at the place where you were involved in sports?
Yes, I was at the University of Wisconsin, and what happened was that they were making loans available, and I was able to stay there and do pre-medical training. And I then got into medical school at the University of Wisconsin. And after leaving Wisconsin, I came here to New York and did my training at Harlem Hospital. And it was like taking care of family.
Yeah. Then from Harlem Hospital, you went up to Jacoby Medical Center and you met your wife.
That is correct. That is correct. And I was in infectious diseases at that time.
Yes. Excellent. What is your role today as a medical director of the Division of Disease Control?
Well, today, my role is one of, I am essentially the medical backup for the commissioner. I'm serving as a deputy to the commissioner, and I essentially am working in a clinic where our public health nurses are involved with testing. Initially, it was the COVID testing. We then became involved with the vaccine program. So I was essentially a medical person, the medical person in charge of our vaccination program all over the county. And prior to COVID, I was actually involved with tuberculosis treatment and diagnosis. And we also have a sexually transmitted disease clinic here, and we also have an HIV prevention clinic. So all of those are services that were still available and are ongoing here at our clinics. But we're involved with a lot of education as well, a lot of community outreach, a lot of town halls, trying to inform people and give people very objective, accurate information about COVID and about how they can stay healthy and about the vaccine as well.
Doctor, what information do you have today? You know, a lot of people saying that, you know, you can put your mask away and as long as you took your vaccine. And what information do they have out there today? Because people are like, you know, okay, we're wide open now. We're back to normal.
Well, I think we have to be very cautious, Dr. Lee. What the CDC did, and they announced it last Friday on the 25th, was that they've divided the country or categorized the country into three categories, what they call low risk, medium risk, and high risk. Individuals who reside in areas of low risk or medium risk, which includes our New York area, it has been said that those individuals do not need to wear masks indoors any longer. If a person, however, has a immunocompromised kind of a condition, they, of course, need to continue to protect themselves.
Yeah.
We have to be cognizant of the fact that 70% of people reside in areas which are considered low risk or medium risk, but then the other 30% reside in areas which are still considered high risk. So if you're going to a place like Los Angeles or San Diego or Hillsborough County, Florida, with Tampa is, I think, an example there, they still are high risk. And so if you're going to those areas, you have to take the same precautions. The children who are attending schools in areas that are considered low risk or medium risk can also be relieved of having to wear masks in these settings. The same precautions, however, do have to be observed if you become infected. You still have to wear a mask and you still have to remain isolated for 5 days if you develop the infection.
Are there new variants that are out there that we should be worried about or should watch for?
Well, of course, the Omicron variant was the one that we were most worried about, and it appears that that has passed. There was a variant known as the stealth variant, which we really didn't hear much more about. We were very concerned about it. There will always probably be some variants that will be occurring. But the good news is that the vaccines seem to be very, very effective against all of the variants that we've seen so far.
So what should people be doing today to continue to protect themselves? Because I always talk about the 3 W's. Wear that mask, watch your distance, and wash your hands. Should we still apply that today?
Well, yes, I think in many situations we have to do that. I think if you're going to be in close proximity with large groups of people and you don't normally associate with those people, it's probably still a good idea to wear the masks selectively. I think that we can probably relax things if we're with people that we are with all the time, our family, our close friends, and we know their vaccination status. The categorization that the CDC put together was based largely on the fact that you have areas like New York where you have a high percentage of people who were vaccinated and also a high percentage of people who were recently infected. And so the main people that we're worried about right now are our young children, especially our children under the age of 5. And there's no vaccine yet for them. But our hope is that within the next month or so, the FDA is going to approve the vaccine for those children.
So do you think we're out of the woods now? Sort of, kind of?
I hope we are. I really hope we are, but we have to remain vigilant.
Yeah.
We have to keep our guard up.
Doctor, you spoke about outreach. The outreach program at the Westchester Health Department, does that mean you're out in the neighborhood? You go to schools and community centers and things of that nature?
Well, yes. However, we've been doing most of it virtually. So we've had a lot of virtual town halls, and we have interacted with many, many types of groups, schools, community centers, groups. Sometimes it's been different towns, for example, Yonkers, New Rochelle, Mount Vernon. Whoever wants to talk about health and preventive health, especially around COVID, we are always open and receptive to speaking with them. That's really part of our mission, part of our goal. I'm proud to say that we actually received a grant from the U.S. Department of Health and Human Services. And this grant is to promote health literacy, so that we're educating people about their health, certainly centering it on COVID, but educating people about their health so that they can stay healthy and get connected with primary care services.
Well, what are some of the things people can do on maintaining healthy habits, especially during this time, during the pandemic? I'm still thinking that the pandemic is still here.
Excuse me. I think the things that they can do that I'm really keen on is making sure that we are addressing our primary health problems. So a disproportionate percentage of our population, African-American population, suffer from diabetes. We suffer from hypertension. Many of us are a bit overweight. We also have respiratory disorders, and being plugged in with primary care so that we actually are treating and controlling these conditions will put us into a much better position if we ever have another pandemic like this, or even if we are talking about things like the flu. So all of these things, if we can be plugged in to regular medical care, it's going to put us into a better position. Obviously, when we talk about people being overweight, if we are able to look at our diets, and if we're able to look at things like exercise, these are all things that are going to put us into a much better position and protect us in the event that we run into these types of things again.
Yeah. Is the Westchester County Health Department involved in any health fairs that are going to be coming up in the spring and summertime? Well, I know people sometimes you can find out if you have an ailment right on the spot when you're out there in the community.
That's a good question, Dr. Lee. We regularly did this before the pandemic. I think that now that things are coming under control, that is going to be one of the things that we're going to be doing again. So we have done things like blood pressure screening and other types of screenings. I believe that's something that the commissioner probably is going to want us to start doing again. And we're happy to do that for community organizations, whether it's churches or other groups. We're always very happy to set those things up.
Doctor, thank you so much. We appreciate all that you're doing in our community. Give us a website where we can go to get more.
Thank you for having us. You can go to the Westchester County Department of Health website. I believe it's www.westchestergov.com, and you will find a lot of information on health at that site.
Dr. Dial Hewlett Jr. Thank you, thank you, thank you.
Thank you, Dr. Lee, for having me.
All right, that's about it. It's a wrap. Thank you so much for tuning in. Thank you for checking it all out. Always remember this: what you are is God's gift to you, and what you make of yourself is your gift to God. To choose your choice, let your choice control the chooser. For all of us here at BronxNet, have a great and enjoyable day, and I'll see you over 107.5 WBLS later on.